We turn now to the outbreak of the Ebola virus, which is centered in the West African countries of Guinea, Liberia, and Sierra Leone. But there are also now reported cases in Nigeria. Dr. Keiji Fukuda is the Assistant Director General of Health Security for the World Health Organization. He joins us from Geneva. Dr. Fukuda, let me ask you first, what are your latest statistics? Where does the death toll from this now stand?
Bob, where we're running right now is, as of today, there are 1,825 cases reported from the 4 countries. Most of these countries are in Guinea, Liberia, and Sierra Leone. There are 13 cases in Nigeria, and the current mortality rate is running about 55 to 60%.
So that would mean, as of now, the death toll is what, above 900?
Yeah, it would mean that it's about 900, a little bit above.
A little bit above. Could we expect the death toll to go higher, or do you think we're at a peak here, or where are we on this?
Bob, I think that we anticipate that there will continue to be cases, and if we continue to have cases, then we will continue to have people dying from this disease. This is a severe infection, so we expect both numbers to increase over the coming weeks.
Would you call this, at this point, an epidemic?
Well, it's certainly a large outbreak affecting that region, and typically when outbreaks get big enough, we call them epidemics. But I think that the way we think about it is that this is something which is arisen and can be stopped. And so, among the people working on it, we frequently call it an outbreak right now.
So you feel that it can be contained, but I want to just ask you, the World Health Organization, do you need more help from other countries? What needs to be done here?
Sure. Bob, this is definitely an outbreak that can be contained. We know that this is not a mysterious disease. It's a severe disease, but we know it's not mysterious. And what I mean by that is that we know how this virus is transmitted. It requires one person touching another person and coming into contact with bodily fluids. And because of that, and we know when people are most infectious, this virus can be stopped. But what's difficult in this situation is that we're dealing with countries with weak health systems, and we're dealing with areas in which practices like good infection prevention and control practices are not the norm in some of the hospitals and in families and communities. And so what we need here is really to scale up. And so we know what to do, but WHO, working with many different countries and many different partner organizations, need help in making sure that we can do the things which are needed to stop transmission.
Well, let me just ask you about a couple of things. Should there be an international travel ban, for example? Some of these countries, I know, have been closed, but should we be more strict than even that?
Bob, we recently convened a meeting of the Emergency Committee under the International Health Regulations, which gave advice to the Director General. And the Director General concurred with the recommendations or the advice coming from that committee, and one of them is very clear. WHO does not support a general ban on travel or trade. We do believe that people who have infection or people who are contacts of people who have infection and are being monitored for the 21-day period should not travel. But otherwise, we do not believe there should be a general ban on travel or trade.
Dr. Fukuda, let me ask you this, because I think a lot of people are worried about it. Are you confident that this disease won't spread from Africa to Europe and then into North America?
Bob, I think there's 2 important points to make here. One of them is that in this modern period, this globalized world we live in, it's clear that any person can travel anywhere in the world with an infection. But it's also important to know, in terms of this disease and this outbreak, this in many ways is a poster child for what it means to have health systems which are weak. That means that the surveillance systems are not strong, there may not be enough healthcare workers, and so on. So I think that while it is possible for someone with an infection to travel to a number of countries, perhaps in Europe, perhaps to North America, like the United States. And it's possible that you may have some few cases associated with that, few infections. I think that in those countries which really have good health systems, good health professionals, good surveillance systems, it's very unlikely that you would have large outbreaks in the way that we're seeing them in these countries right now.
Well, Doctor, we want to wish you the very best as you fight this thing. Thank you so much for joining us this morning.
Thank you, Mr. Schieffer.